in the midst of planning for vaccination, and obviously we're following the CDC and the state government's plan on distribution. What really the first step in the distribution is what they call the 1A, which is immunizations for healthcare workers and residents of long-term care facilities. So really looking at where are our workers in the highest risk as far as the ICUs, the respiratory clinics, the EDs that need vaccination sooner than later. Some of that plan will vary based on how much allocation of vaccine we get from the state, and kind of prioritizing employees on their risk factors and site of care as far as COVID positive patients, and then we can start rolling out as soon as we get vaccines. We're still waiting, and hopefully we'll know soon. Next week is kind of we're ramping up our meetings, and hopefully we plan to have those numbers coming to us. I think I've heard the state has 50,000 doses available right now that can be shipped out once it's approved, but that's not nearly going to cover all the healthcare workers in Wisconsin. So it will be allocated out to regions, and we're just waiting to hear what our allotment is so we can make plans to use all those vaccines for staff. Authorization, we're strongly recommending it, especially in care situations where you're going to be caring for COVID patients and you're critical to the operations of the hospital, so you're not missing work. But right now it's not going to be mandatory. Probably everyone knows that the COVID capacity and COVID cases have been fairly high in the Northeast and central Wisconsin. But really, I think people have been doing a good job of masking, distancing, and wearing hands, because we had seen a plateau and a slight decrease in the number of admissions. Still have more than we'd expect in the ICU, so those real severe cases are still here. And just kind of following it closely, because we're not sure really what's going to happen since Thanksgiving. Now that's a week out. Are we going to start seeing increases of cases if people were a little less strict with their distancing step? So depending on how many we get to immunize health workers, and it probably won't be enough to get everybody. So that next batch will help continue finishing that off. And then looking at how do we then stratify who in the community is the next up. Through our primary care offices, we've designated a couple of areas. Now we have about 12 that could be vaccination sites. And so then we could get the vaccine distributed out, announce it, get people scheduled, and start vaccinating the community in the near future. Around the corner, it's a pretty big corner to get around. Because think about it, they have to produce the vaccine for every person in the United States, in the world, and there's 330 million people in the states, and they both need 2 doses to be able to complete the immunization. So that's 600 and some million doses, which is a lot. So really, it's still important to reduce the distance, or maximize the distance between people, hand washing and face masking, because that will really get us through the next 3 or 4 months until everyone can be immunized. Here, obviously continue with the hand washing, masking, distancing. And I think even if you've gotten the vaccine, because that will really help prevent the spread, but also important this year is to get the influenza vaccination. Really, both the respiratory viruses, getting the influenza vaccine is known to help reduce that disease, and we don't want to have both going around the community together. So please get influenza vaccination.